Hi, I'm Dr. Nikolai Nunes from the MBBS class of 2020. I'm going to talk to you a bit about electives. You get 2 elective periods, both of them 5 weeks, one in year 4 and one in year 5. In the 4th year, you only need to use 3 of those 5 weeks in your official elective. So the other 2 weeks are yours for whatever you want. In your final year, you have to, however, use all 5 weeks in whatever you choose for your elective. I'm going to talk to you about non-traditional electives, as in non-clinical electives. I'm actually a future public health, global health person, and so I was not much interested in doing my elective in clinical medicine, but using that time to enhance my public health and global health competencies. So in my 4th year, the junior elective, I actually used that 3-week period out of the 5 to present my research and student leadership work at conferences in the US and in Europe, and attend an IFMSA meeting as well. And so what I was able to do is work with the faculty to get my elective approved under that non-traditional educational research direction of the elective options. It's very much a minority, and it's something that needs to be strengthened and grown, but the option is there. And so service learning, for example, going to the Ministry of Health to do an internship for 5 weeks, or PAHO, or a non-profit, all of these things are just genuine areas to strengthen you in terms of your professional development and personal development, and opportunities that you can look into. I would advise that you, if you want to do this, go to your elective coordinator, which is Jean Williams Johnson at Emergency Medicine, and also liaise with the intended supervisor, because every elective needs to have somebody supervising you in that academic capacity. So figure out what you want to do, approach the intended supervisor, and then discuss with them, work out objectives that you want to meet during this time period, work out the metrics of how they'll be assessed, and put together that proposal. Then take it to Dr. Williams Johnson, who is really one of the nicest people in our faculty, and very much encouraging a diversity of elective options, and work with her as well as the FMS administration to get it approved. And then once that's done, you should be good to go. I would advise that you start this process as much as a year in advance, but definitely within 6 months before the actual elective period, just because there's a lot of bureaucracy involved in a lot of these things. And while elective is pass-fail, you, however, to pass the elective, you have to have these goals and objectives to meet that you set, and metrics to measure them by. You know, you can work with your supervisor to come up with some smart goals and work towards that. I personally had a great time. Let me correct myself. I actually went to Montreal, not in the US, to the IFMSA 2018 August meeting, and then I went to Ireland, where I presented on organizing student leadership structures in the faculty, and I presented that. And then I went from Ireland to Switzerland, where I was part of the Association for Medical Education in Europe Student Task Force, which is the premier medical education organization in the world and conference. And I was a part of organizing those logistics and taking part in the conference. And it was a great 3 weeks. And then I relaxed for the other 2 before I went back to school to do back into my clinical setting, which was my obstetrics rotation. So definitely in the region, we need to expand our physicians with global health, public health competencies. I would encourage you 100% to go after these opportunities. So thank you, good luck.